It's the program Healthy Living on independent television. I'm Adisa Walsawage. I most sincerely apologize for coming on behind schedule due to circumstances beyond my control. But I'm here now and we're ready to serve you. We have few minutes, but we're going to roll all the same. Make sure you get educated, you get informed, and of course know exactly where to go to. We're going to talk about the eye today. What are the common problems we usually encounter when it comes to the eyes? The eyes is a very sensitive part of the body, and we'll try our best to make sure that you are educated. A lot of persons do things to their eyes that ought not to be, and before you know what is happening, you have endangered yourself. You may go blind. You know, you may go blind totally or partially, or something may just not be right with you, because they say the eyes is the window to the soul, so to speak. So I have with me in the studio Dr. Uwa Amadi. She's a specialist in this field, and she's going to be talking to us about the eyes. It's nice to have you join us today.
Thank you very much.
This is not usually our practice, so, but you know, when things happen sometimes, you just, or when they say, when life throws you a lemon, you make a lemonade out of it. So let's quickly make a lemonade out of what life has thrown us today on the program. Happy to have you on the program. So the eyes, talk to us about the eyes.
Okay, first of all, I'm going to introduce myself properly. I'm Dr. Uwamarin Amadin, and I'm the founder and CEO Brella Eye Care and Eyes for the Future, a foundation for children. Okay. Okay, so concerning today's talk, the common eye problems that is of concern to many individuals as it is, and that causes partial blindness and sometimes complete blindness, and of course some of them are quite avoidable. So that's what I'm going to be talking about today. The first one I'm going to be talking about, of course, is cataracts. Cataracts is a condition that affects the lens of the eye, and the lens of the eye is like the mirror of the eye. So anything that affects the lens of the eye, of course, it disturbs vision. So it depends on the stage of the cataracts. It's going to be either a partial blindness or a total loss of vision. So cataracts, of course, it has cure. If you're being diagnosed of cataracts, surgery is the cure for cataract. It's not like other conditions of the eyes that don't have cure. So cataract has cure. So if you find yourself of being diagnosed of that condition, you should be happy that at least there's a cure for it. And then your sight might be restored. Depends if some other parts of the eyes are healthy that is needed for vision. Then the second one I'm going to be talking about is allergic conjunctivitis. That one is very common because, for example, this period, I think we are being led into the Harmattan season this time around. So a lot of irritants goes into the eyes, exposure. Those are the things that can cause allergic conjunctivitis. When the symptoms are presented, of course, you should report to your eye doctor. You should report to your eye doctor so that you get the eye checked and the appropriate medications be given. It has cure also. It's not something that you leave in your eyes and start trying to manage it with one treatment on the other. That I don't think I should understand that kind of treatment. So it's very easy with just some drugs, few drugs, not expensive drugs. You should be able to take care of that. There's also bacterial conjunctivitis that can still be managed with drugs. Then another condition again that is of importance and a very good threat to sight is glaucoma. Glaucoma is a condition that people dread so much. And of course, it has to be dreaded because it causes irreversible vision loss. Actually, glaucoma is 100% hereditary. If it's in the family, if there's someone in the family that has glaucoma, of course, then members of that family, they're at risk factor of having glaucoma as well. So glaucoma, we can't say it have a cure, but it can be managed if it is discovered on time, and then you don't have to be scared of losing your sight. So that's why regular checkup is advocated for. It's good to go for regular checkups so that you check on time if there's any risk to you having glaucoma. Then another one that we're going to be talking about is macular degeneration. Macular degeneration is a kind of eye problem that affects the macula of the eye, which is the same part of the eye. Let me use that language. any condition, any macular degeneration to the eyes can cause, of course, partial blindness or total vision loss, depends on the stage at which that disease was diagnosed. Now, macular degeneration can be managed as well with drugs. There are also some risk factors to macular degeneration. There's obesity, there's smoking, hypertension. Those are risk factors to macular degeneration amongst others. Then other conditions of the eye too that are also avoidable. We have refraction error. It's very common. Refraction error, what it simply means is that the eye needs glasses. With just glasses, you can be able to get solution to that one. When you are on your glasses, your correction glasses, you are able to see properly. So a lot of people run away from using glasses. They'll be like, I don't want to be confined to using glasses because they think it's one big thing, but actually it's not. It's not. If you have your glasses on, you can see what I'm putting on. It fits me so much. So if I have my prescription on it, I'm so happy and proud to put on my glasses. So you shouldn't run away from it. Refraction error can come at any stage. Children are born with refraction error. It could also be acquired. For example, in this digital age that we are in, we use the system a lot. In fact, like in my clinic, we use system record. So we are always exposed. Computer eye syndrome come into this class and category. So glasses will definitely do a marvelous work here. So don't be scared of putting on glasses anyway. Glasses, you can have different frames that will suit what you're putting on and all that. You can use your contact lens if you don't want to wear your glasses. That's a very good way of also taking care of your eye problems.
All right, thank you very much, Dr. Owa. You've told us quite a number of things today regarding the eyes, and I'm so pleased to, let new things. Now let's look at this refractive error thing and the glasses syndrome. A lot of persons don't want to use glasses, particularly children. You say that some parents would know that their children are complaining about, not seeing properly in class, water coming out of the eyes and all of that. And then they don't even want to go to the hospital either to go do some checkup to see what is actually wrong with these children, because we've come to realize that most eye problems starts from being little, and then because of lack of attention, one tends to grow up with it, and before you know what is happening, a lot of problems are coming up with the eyes. Why is it so difficult for parents to, allow their kids to use glasses? They see it as a, quote, God forbid thing for my children to use glasses.
Okay, that's for the children aspect.
Let's start with the children.
Even the parents themselves don't want to put on the glasses. So how would they want it for their children? So they need this, they need to be sensitized so much. Like in my program, Eyes for the Future, we target children. We try to encourage them. I even have a book that I'm writing about using glasses, how to encourage children, put it into cartoons and all that. So eyeglasses, they are not bad. They are not bad at all. Eyeglasses, just like you taking Panadol for your headaches, that's how eyeglasses are. They are medicinal as well, if you want to put it that way. If you have a refraction error as a child and you don't put on your glasses,
that is if the parents care enough to know what is really wrong with the child's eyes.
Yes, it gets worse. It gets worse. I'm sure a lot of parents are listening to this. It gets worse and it becomes more difficult, or it becomes difficult to take care of that condition. Parents, with this program, we're also encouraging you to please allow your children, if it's just the eyeglasses that will help them see better, will help them focus in school, allow them to use glasses. Glasses are not bad. Don't think about what the society thinks about people putting on glasses, that they are blind people. They are actually not blind people. Your glasses could also add fashion to your life. You get it? So allow your children to use glasses. There's nothing wrong with using glasses at all.
Well, talking about glasses, a lot of persons have different things attached to wearing of glasses. A young man the other day said he was not going to marry a woman again because she wears glasses, that he doesn't want his children to go blind later, or he does not want the woman to give birth to blind children. Please, a woman who wears glasses, what will happen to that woman when she gets pregnant? Does it affect the child in any way?
Oh yes, refraction error, of course, is hereditary. It's just like albinism. A black person can get married to an albino and they will give birth to black children all through. In some other cases, they might just give birth to albinos, some other cases mixed, of course. So that's the way it is too with refraction error.
Okay.
Now, if you're having refraction error as a woman, even as a man, you can pass it to your children.
Okay.
Your first generation might even miss it, and it will go and come out in the next generation, you know. So, of course, it's hereditary, and if you love the person enough, I don't think that should be a problem. Because if you give birth, if as a man you are rejecting it, you don't want your child to use glasses, and so you don't want to get married to that woman, what if the woman pretends that she doesn't have eye issues and she's just managing, and then you don't get to know because you are not an eye doctor, of course, and you don't get to observe the person, then you get married and start having children that needs glasses. Will you say that they should not put on glasses? No. So it's not their fault that, it's not anybody's fault that the person has refraction error. Yes. It can be acquired, like I said, or it could be hereditary. If you have a child that has, if you have a female child that has refraction error and the person is not able to get married, will you be happy as a man? You won't be happy as a man. So it's not a bad condition. If somebody that's already wearing glasses to take care of the eye problem, you should know that the person is careful enough to take care of herself. So why reject the person? Okay,
a child that is born blind, is it possible for that child to see later in life, or is that going to be permanent?
Okay, depends on the condition that is attached to that loss of vision. Okay, if it's a case of congenital cataracts, the child can be operated upon and then regain sight, even if not to the fullest, but at least glasses can then help to improve on the sight. Then if it's in the case of full-blown glaucoma, there's actually nothing that can be done about it. As a child.
You know, I'm tempted to ask, okay, let me just ask this question. What could be the reason why that would happen to a child who's just been born into the world?
Hereditary, and probably depends on what the woman was exposed to when she was pregnant. Okay,
like things like what?
Maybe alcohol.
Okay.
Alcohol,
or make a child go blind.
Maybe all those herbal mixture that they take in, don't know, could attribute it to that, or probably traces of hereditary in the family somewhere. Like I said, it might not affect the first generation, it will go and come out in the next generation. Sometimes some of these things are unexplained.
Okay. All right, as a pregnant woman, it is very important that you mind what you do. Mind what you do, not because of you, but at least for the health of your child. Anything can happen, okay? So just mind what you do and make sure you visit a healthcare center where you will be taken care of. Now, glaucoma is one thing that is disturbing people a lot. And the amazing part of it is that there is no sign, no symptom. One may just wake up and go blind one day, or walking on the street, you just lose it. Now, what should one look out for?
Okay, so
at least there should be something one look out for when it comes to the issue of glaucoma.
Okay. Glaucoma is usually referred to as the silent thief of sight. It doesn't mean we cannot know about it on time. Regular checkups. You could say every 6 months, I want to visit an eye clinic and get my eyes checked. In that way, if there's any trace of glaucoma, we could capture it. From the pressure to the loss of vision peripherally, to carrying out, of course, tonometry test, and the visual acuity, that's the extent to which the person can see. We can get to know if there are traces of glaucoma. Definitely, if we do our ophthalmoscopy, we'll be able to check if there is any trace of glaucoma or what extent it has gone to. So regular checkup, of course. If in the family there's no history of blindness, and you'll say, okay, there's no history of blindness in my family, there might even be some that you don't know about, because it's not everybody that can tell you their health status. So regular checkup will help a lot. Then some other people, they actually see the symptoms, but they don't know when to report. Seeing halos around light bulbs,
Okay.
It's
Saying
a symptom.
halos around.
Halos around. It will be like rainbow.
Yeah.
And around the light bulb is a symptom for glaucoma. It reduces vision. You know the way you see. You can do a simple test. Close one eye. Look with the other eye that is open. Close the other eye. Look with the open eye. You check if your vision is the same or if it's depreciating little by little. When they say glaucoma is a silent thief of sight, it doesn't mean you're seeing 100% today and then all of a sudden becomes 0%. No, it reduces gradually. But it's you that's not sensitive enough to know, maybe because you've not studied yourself, to know that, I was actually seeing this before, I'm not seeing it again, let me report. Then some people, they just ignore. That's just it. So, well, regular checkup, because it definitely will not tell on time. It would have like been 50% gone before you might start seeing this symptom or signs, as the case may be. So regular checkup will help a lot to diagnose glaucoma. Then tension in your eye. Do you feel tension in your eye? Sometimes you'll be as if your eyes are heavy. Your eyes are heavy, or you're having ache in the eye. Yes, there are other diagnoses too.
What about twitching? Sometimes your eyes will just be
spasming.
Yes.
It will be as if the muscle of your eyes are moving.
Yes.
And that's also tension in the eye. It's tiredness of that muscle. So anything any symptoms that you just leave glaucoma aside now, just know that if there's any reason for you to check your eyes, check your eyes. You're not going to the hospital to check your eyes because you think you have glaucoma. You just want to go and check your eye to find out if there's really anything going on at the back of your eyes, because it's only the front that we see, you know. So if the eye is not red, if the eye is not itching you, if the eye does not bring out discharge, doesn't mean that the back of the eye should be totally healthy as well. So just go for a regular checkup if you are not sure, to just clear your mind and know your heart status for the eye.
All right, some persons have complained that, you know, particularly drivers, that when they are driving, sometimes they don't see what's coming on their right-hand side or on their left-hand side. Could that also be
that's a very good sign of glaucoma as well. That's the peripheral vision I talked about. Yes. So when glaucoma, it starts taking the peripheral vision first of all before it gets to the central. And you know, the central is the point of fixation. That's the point that we see through. So if the central vision is still spared, you are still saying it to be as if everything is okay, but the vision is already being lost from the periphery. So there is a test too that can be conducted to know the extent of loss. And that's a very bad thing for drivers, because when you are driving, you know you are not driving just your car. You are driving the car behind, at the side, even the one at the front, you know. So that one has to be noted a lot. And you can also do that as on your own as a test. You just try to observe, point your finger to one side, try to see the extent at which you can see the finger. You will definitely...
Can you demonstrate that? Let me see.
Just be sitting straight ahead. Then put your finger at the side.
Then you put your finger at this side like this.
As you're looking forward, definitely, if your peripheral vision is full, you should be able to notice that there's something at my side there. There's a finger there. You understand? As far as this my finger is, as I'm looking straight, I can see that, of course,
you see it
I have
clearly.
a finger.
You should see it clearly.
Yes, you should see it clearly. So that's also a test that you can perform on your own to check for your peripheral vision.
That's quite interesting. You just put your finger like, but because I know my finger is there, I'll be tempted to say that, okay, my finger is there, all right.
You can ask someone to do it for you if you don't want to be partial.
Okay, so ask someone to do that for you.
The person might just raise a pencil for you or anything, an object.
And you must look straight.
And you must look straight.
You don't have to like
no. You just
try to move your eyes.
The person will definitely give you a physician. Say, just be looking at this thing. Why I raise up. Can you tell me what color is this?
Okay, like so, I'm looking straight into the camera now. I should be able to know what is on my right-hand side and on my left-hand side.
Your right-hand side.
Of course, I already have a memory of how the studio looks like and the things to expect. Okay, what I'll do is when I get outside, I'll do that test.
Maybe
it's
to
very
an environment
important.
where you are not used to.
What I'm not used to. Because when don't do it in an environment that you're used to, okay? So not in your sitting room, not in your bedroom, because you will always know that such a thing. Because I know there's a door here, there's another here. You know,
come to the clinic, we'll do it for you.
Better still, the clinic will be better. Okay, now let's look at the things people do to their eyes. A lot of persons put all sorts into the eyes, all in the name of making the eyes clearer or brighter for them to see well. There are some persons who will put alcohol into the eyes, you know, local gin, particularly when that person has conjunctivitis, or when somebody who has conjunctivitis is around that area. You see all sorts of prescription, all sorts of eye doctors will come up. Now you're being asked to put breast milk into the eyes. Some is alcohol, some they mix all kind of things. Some they just ask you to pluck a certain leaf or the other, squeeze, and then allow the juice to drop into the eyes. All of these things that people do to the eyes, what's the implication?
I don't encourage that. It's not part of my practice, and I know it's not good enough.
But does it work?
Because it doesn't. To me, it doesn't. If it works for you, fine. I think it's your mindset, but it doesn't work. It doesn't work at all. It doesn't work. It can cause more damage to your eye. And you see, this eye is very superficial. It's so open. Anything that harms your eye, for example, maybe glue pours into your eye, you know the kind of pain you will feel. You understand? So anything you do to your eye that way, and it will cause damage to your eye. There are some things that it can just pass. Though some will be absorbed into the system, definitely, but some of them will just wash away as a result of the tears in the eye that keeps lubricating the eye. But it's not a very good practice. It's not a good practice. Not that it's not a very good practice. It's not a good practice. From being a baby, there are ophthalmic solutions that can take care of eye problems, either manage it or just give a permanent cure to it. So that practice, I don't encourage it.
Mothers do that a lot. Once they see pus in their baby's eyes, the next thing they are, pressing breast milk into the eyes. That's
not good at all. I don't know if to say the mothers are being ignorant of that, but I know a lot of mothers too, even with newborns, they come to the clinic. So I think you should follow the footstep of those mothers that come to the clinic to take care of their children, and don't put non-medicinal things into...
the idea of going to the hospital because of the financial implication is one of the reasons why most women don't like to go to the hospital.
Of course.
There's no money, nobody wants to go to the hospital. Particularly for the eyes. People don't really take the eyes serious
at all. They don't take the eyes serious.
It took me a while to start wearing glasses, because how will people see it? This is my age, I'm not old. We used to see as old people staying.
But since you started wearing your glasses now, don't you feel cool?
Don't laugh. I feel
the stress is reduced. There's no tension in the eye anymore.
Very, very much so. But that is the idea behind it. People don't want to wear glasses because of age. I'm not old, and I've come to realize that wearing of glasses is not an age thing. I was so shocked when I saw little babies in the hospital wearing glasses. And I was like, and very thick glasses for that matter. And I wonder why.
It's refraction error, and the glasses help them perform better. So why not? Why not? If you want to be part of the society positively, you have to take care of yourself so that other people can respect you and accept you as being part of the society. If, for example, you are supposed to put on glasses, and that will help you do well in your book work, help you to become a better person in the society, why won't you? Why won't you put on your glasses? Because like a lot of students, over time, with the kind of work that I'm doing, Eyes for the Future, children, preschool children, school-age children, we attend to them a lot. Though some parents, they are still reluctant about, we are giving you free glasses for God's sake. You get it? We are giving you free glasses, so what is it? They will still say no, they don't want their child. Meanwhile, they are punishing those children. Because with time, as they grow older, maybe when they are now independent, for example, they will still go after these things to take care of themselves, to find out why is it that I'm not seeing the way my mate is seeing, the way my friend is seeing. You get it? You'll be in the class, you'll be in the at the back of the class, you're not able to see the board. The same thing, you'll be at the front of the class, you still find it difficult, So why wouldn't you put on your glasses? So parents that are depriving their children for putting on glasses when there is need for them to do, they are not doing them any good at all. They are not doing them any good at all, because with time, it might be very difficult or even more expensive to take care of those conditions.
All right, you know that when it comes to the eyes, people talk about glaucoma, people talk about refractive errors, people talk about cataracts. But people don't talk about other things that may cause problems to your eyes. Now let's look at ladies with, I was passing through the market the other day. You know these eyelashes, we love it a lot. And you see quite a number of persons use it. Is it dangerous? I'm talking about the eye extension now, if there's anything like that.
Eyelash is, it beautifies a woman, you know. If you use it occasionally, probably when you have a function or the other that you just want to look so beautiful, you can fix it on. Like I, for one, I hardly use eyelashes.
But you use at all?
I use, yes, I use, and I make sure it's the small one that does not give my eyebrow so much weight. Okay, now you're using your very heavy or long eyelash. It becomes heavy to the eyelid. And you know this eyelid, what makes us to blink? I'm going to come on layman's language. What makes us to blink, why your eye can open and close at the same time, is controlled by the muscle of the eye. Controlled by the muscle of the eye. So if you're not putting weight on that muscle of the eye, what do you think? Don't you think that there comes a time when the muscle will get weak? Then when you want to open your eye, you have to forcefully open your eye or forcefully blink. Don't you think? It can also cause spasm in the eye, the twitching of the eye that you talked about. That has to do with muscle problem. So if you're using things like that, that beautifies you, of course, you should use them with caution. Use them when the needs arises, not every day. Some people sleep with it. I just look, how do you tell those people every time? Some even don't want to hear it because without the eyelash, they look different. They look horrible because they have already used that eyelash to just change the way they look. They can't help it again. So it's not, eyelashes is not so good. It's not so good for the eye, especially the very long ones that has weight, that puts weight on the eyelids.
Okay, what about contact lenses? Because that is part of fashion these days. And I've heard people, those who use it wrongly have serious eye problems. How true is that?
Contact lens is contact lens.
We're not talking about the prescription contact lens now.
Yes, we have the prescription and then we have the fashion contact lens, of course. Contact lens falls on the cornea of the eye. So definitely, any risk factor that is attached to using contact lens as a prescription is also there while using it for cosmetics purposes. Contact lens, of course, it gives clearer vision. There are some cases where you can't use glasses. For example, maybe you are going to the pool and your vision is very poor. You have to use your contact lenses. Contact lenses has to be handled with care. It has to be handled with care a lot because as we open our eyes like this, we blink through the cornea, air enters into our eye. All those things are needed for the eye to be healthy. With the use of contact lens, you don't get that direct air into the cornea of the eye. You understand? So there are a lot of eye condition that goes with using contact lens, whether it's cosmetics purpose or whether it's correction purpose. You understand? We have it can cause conjunctivitis. You know about conjunctivitis in the eye, and it's not just the small conjunctivitis, the giant form of conjunctivitis. It can cause bacterial infection to the eye.
That's if you use it wrongly.
If you don't use it with care, if you don't use it the way, normally if we ask you when you want to use your contact lens, wash your eye. Same, if you want to remove the contact lens from your eyes, wash your hand very well. So now, maybe something flies into your eye, for example, and you want to remove the cornea, you won't even think of washing your hand at that time, especially if there's no water. You just put it straight into your eyes and remove your contact lens. So all those things, they are risk to the eye. They pose risk to the eye. So if you know you are ready to use contact lens, then you have to be a very careful person. And contact lens is not something that you wear all the time. Of course, when you want to sleep, you have to remove your contact lens, put in your rewetting drops, and and all that. Contact lens is not an easy way of correcting the eyes anyway, but there are some eye condition like those people that have bottle kind of glass.
Yes, that's very
you can compress it into contact lens and be using, and people don't even get to know your eye. It has a lot of advantages, just the way it has a lot of disadvantages. Contact lenses, it can contain your refraction error such that people don't know the kind of lenses that you are wearing. Somebody can just look at your eye, you're wearing a thing and say this eye is gone. But with contact lens, they won't be able to say that. But at the same time, contact lens can cause some conditions in the eyes. Bacterial conjunctivitis, allergic conjunctivitis in the eye can make the eye red. You understand? Even fixing it into the eye to be as if there's a foreign body. Into the eye. Sometimes the eye might go red, which you don't get while using your spectacle.
So when the eyes go red, what do you do? Quickly remove the contact lens or what? You must
remove your contact lens before you treat any form of infection or allergic condition to the eyes. Okay. You can't put your contact lens inside your eyes and be treating those things to not penetrate. Okay.
Thank you, Dr. Uwa. I know that some of you would have loved to call into the program, but we just couldn't take calls today, but we'll definitely take calls next week. But if you want to continue with this conversation, you can call 080-3218-4887, particularly for those parents who have children with eye problem. We're not talking money now, okay? Just try and call this number so that you can discuss with Dr. Uwa. If you know that your children, I'm not talking about you adults, if you have a child who is having difficulties with the eyes, please call 080-3218-4887. It's part of our social responsibilities, okay? We want everybody to be fine, particularly our children, because these are the leaders of tomorrow. They are the future. So we must take care of them now, all right? It is not a thing of shame for your child to wear glasses. And as a parent too, it is not a thing of shame for you to wear glasses. It's to make you function properly and to make that child function properly too. You never can tell. That child that is not doing so well in class, that is not writing, that is not seeing the board, you know, just do this little Christmas gift for that child, and I'm sure your child will be happy. 080-321-84887. Call that number and we will respond, okay? Thank you, Doctor, for finding time to be with us on the program. We'll see you guys again next week. Bye-bye.